Good day, everyone. Today, the Group 7B of PCMT 3D will conduct a clinical case study of a 37-year-old male with cyclic fever and severe headache.
So first, we will have the chief complaints. A 37-year-old Indian male presents to the emergency department with complaints of a cyclic fever for about 102 to 203 degrees Fahrenheit. A cyclic fever is also known as a recurring fever. It is a kind of fever that happens multiple times over a period of time. And these fevers can sometimes be described as episodic, meaning they come and go. Next is the chills, fatigue, and severe headache. His travel history is significant for a recent 2-month vacation to India, and he is concerned he has malaria due to its symptoms. So for his physical exam, the patient is ill appearing with dry mucous membrane that has no aversion to light or neck pain. For his blood work, he has normal white blood cell count and elevated liver enzymes such as the ALT and AST. Elevated liver enzymes often indicates inflammation or damage to cells in the liver. So next.
So here are the laboratory findings of a patient obtained in a gram stain on a mcconkey agar and on hecton-enteric agar. In the first picture, a gram stain result shows a positive blood culture illustrating large gram-negative rods in a light microscope. Gram-negative bacteria has a thin peptidoglycan layer compared to gram-positive bacteria. So the reason why gram-negative bacteria appears pale reddish or pink under a light microscope because they are unable to retain the crystal violet stain, so they absorb the serpentin counter stain. Next is a mcconkey agar. So this result shows a small lactose-negative colonies growing on mcconkey agar after 24 hours incubation and CO2 at 35 degrees Celsius. So Salmonella typhi is a aerobic bacterium which grows best in the presence of oxygen, and it is also a facultative anaerobic organism, which means that it can also grow in a low oxygen level or environment. So in here, it shows that it has a clear colonies and it is a lactose. It cannot ferment lactose, and when an organism cannot ferment lactose in a mcconkey agar, the colonies will appear colorless or sometimes medium color of orange to amber. Next.
So next is, as seen in the picture presented, green colonies grew on hecton-enteric agar after incubating for 24 hours with an oxygen at 35 degrees Celsius. So originally, hecton agar shows green, but when it is lactose fermenter, it will turn blue. So the colonies are green, they grew green. Next. So the diagnosis of Salmonella serotype typhi was confirmed. So as seen in the culture, it has a growth. Then for other tests done, testing for influenza, viral hepatitis, and malaria were all negative. So the only positive is the growth of the Salmonella serotype typhi.
So treatment with antibiotics such as ampicillin, chloroquinolin, trimethoprim, sulfamethoxazole, and a third-generation cephalosporin is necessary for untreated cases of typhoid fever due to high mortality rate. And susceptibility testing should be performed in all cases of Salmonella serotype typhi. In the case of our 37-year-old patient, he was started on ceftriaxone and continued to receive the IV antibiotic for 7 days after blood culture became negative. Susceptibility testing showed intermediate results for ciprofloxacin by disc diffusion, and azithromycin was found to be susceptible with an MIC of less than or equal to 16 micrograms per milliliter. The patient has an uncomplicated hospital course and made a complete recovery.
So that would be all. Thank you, and I hope you learned something.